In medical news tonight, researchers have found the use of antidepressants is soaring.
A new study published in the Journal of the American Medical Association says that the number of Americans taking antidepressants has doubled in the...
New numbers showing that 1 in 10 of us is on an antidepressant. That's a 400% increase in the last 15 years.
The survey found 27 million Americans were taking a daily antidepressant.
$11 billion a year business. So make no mistake about it. This is also about making money for big pharmaceutical companies.
In less than a decade, spending on direct-to-consumer antidepressant ads nearly quadrupled to $122 million a year.
We have Prozac and Paxil and all of these drugs advertising. The government does campaigns.
The risk is even more Americans will turn to antidepressants too quickly and inappropriately.
For years, different media outlets have warned us of the rise of antidepressants and the capitalist interests of pharmaceutical companies in prescribing antidepressants. Really, what are antidepressants? Most antidepressants fall into one of 3 categories: selective serotonin reuptake inhibitors, tricyclic antidepressants, and monoamine oxidase inhibitors. SSRIs are the most commonly prescribed class of antidepressants. The exact mechanism of action of these drugs, while approved by the FDA, is not understood, but they are believed to promote the binding of serotonin, a neurotransmitter associated with happiness and well-being in the brain. However, serotonin controls a wealth of other bodily functions, such as hunger and wakefulness, so tweaking its natural flow does not come without risks. But do the potential benefits outweigh the risks?
I assumed that the antidepressants worked. Everybody knew they worked. I didn't start doubting that until I started looking at the placebo effect. And when I started looking at the research on antidepressants, I found out that yes, antidepressants work, but they work primarily because of the placebo effect, not because of the chemicals that are in the antidepressant drug. Almost half of the studies that were done by the drug companies have been buried. They have not been sent to journals for publication.
The potential adverse effects of SSRI antidepressants include significant changes in weight and appetite, dramatic differences in libido or sexual function, upset sleep schedules, suicidal thoughts or tendencies, and a feeling of emotional apathy. So what leads pharmaceutical companies or the FDA to believe that these drugs are worthwhile in the treatment of major depressive disorder? The Hamilton Depression Rating Scale is a 17-question survey in which participants rate the severity of different symptoms of depression they experience. This is a rudimentary qualitative approach to a complex disorder. The significance of different responses is inappropriate and is not necessarily reflective of the severity of a patient's experiences. For example, a patient saying they experience an inability to work or anxious fears has the same impact on the overall score as the patient saying they have attempted suicide. The Hamilton Scale is one of the most widely used surveys for depression, along with the Beck Depression Inventory, which has many of the same fallacies. The Beck Depression Inventory is a 21-question survey in which patients respond to each question with a number from 0 to 3, depending on how their symptom is. For example, the first question asks about feelings of sadness. The minimal experience is one who does not feel sad. The maximum is, I am so sad and unhappy I can't stand it. Another asks about self-image. One who does not struggle with their self-image should respond with a 0. The most extreme response adds a 3 to their score. A similar question asks about libido. The most extreme response adds 3. One question asks about suicide. A patient who responds that they would kill themselves given the chance still only adds 3 to their total score. It's really no wonder that studies have concluded that these screenings do nothing to assess or ameliorate depression. They do very little to reflect a patient's condition. So how do these drugs get approved? A meta-analysis published in the New England Journal of Medicine found that drug companies tend to publish the more favorable experiments, but not those that suggest the drug is not very effective. Even those that statistically suggest that the drug is not very useful are presented in a way that makes them seem effective. Additionally, many of the trials for drugs are conducted with a small sample size, which is an unsound research practice. How do we accurately assess SSRIs and other antidepressant drugs? Because depression can be so hard to quantify, drugs need to be assessed with more qualitative interviews that can lead to statistics. Double-blind trials where neither the patient nor therapist knows if the patient is receiving placebo or treatment would help therapists objectively determine the efficacy of the drugs. Meanwhile, there must be some kind of new rating scale developed to reflect the many different ways that major depressive disorder manifests itself in different individuals. Some research suggests that there may be biological indicators that could help us quantitatively identify depression and other mental illnesses. If we want to use numbers to understand mental illness, we need to use the right ones.